Thank you, Mr. Donfried. I would just like to check with you if you can hear me properly. Is everything okay? Okay. First of all, of course, I would like to greet all of you who are present here today on behalf of WHO, as well as in my personal name, and to express my pleasure to have the opportunity here today to put some more light and to bring some more clarity on the role and position of WHO in general, but in particular in the context of COVID-19 and the response to COVID-19 pandemic. Before I start, of course, I would like to share my screen and to share the presentation with you. Can you see the screen? Just would like to check. Is everything okay? Sorry.
Perfect.
Yes,
okay.
it's okay.
Okay, thank you. So the story of WHO starts back in 1945. It was approved by the United Nations Conference. It was actually the very founding conference of the United Nations held in San Francisco in 1945. And the official beginning of the organization happened actually on 7th of April, 1948, when came into force the World Health Organization Constitution. So we have our constitution, which precisely defines all the possible roles, tasks, responsibilities, and the reasons why the WHO has been formed or created. Back, just to explain a little bit more what is the official role of WHO. It provides leadership on matters critical to health, and it engages all partners that could be relevant to these health matters and join them in a joint action when and if it is needed. Of course, WHO is shaping the research agenda and stimulating the generation, translation, and dissemination of the valuable knowledge related to health and public health issues. It sets norms and standards. This is put here at the third place, but actually during the decades, this one is maybe the most important role of WHO since it has been founded. So it is primarily normative agency. I'm underlining this because it will become later on during the discussion and during my presentation very important to emphasize that the primary role of WHO is to set norms and standards. Another tasks or roles of WHO is to articulate ethical and evidence-based policy options. So to provide policymakers in member states with the evidence-based policies and to guide them actually through defining their own policies regarding towards health. Also, one of the most important tasks of WHO is to provide technical support and to catalyze change in building sustainable institutional capacity in member states. Of course, WHO also has responsibility to monitor the health situation all over the world and to assess health trends, to be able to modify its policies. What is important to mention that now we have 194 member states all over the world. They are divided, according to the WHO organization, they are divided into 6 regions, as you can see at this slide. And it means actually that more than 150 countries have country offices of WHO. WHO's work actually is based on 5-year general programs of work. Currently, we are under the 13th general program of work since it is 13th since the foundation of WHO back in 1948. So this one that is currently in place puts three pillars as the most important one. First of them is healthcare, healthier population, which means actually the goal of this 13 GPW is to have 1 billion more people enjoying better health and well-being. The second pillar of the current GPW 13 is actually to have 1 billion people more benefiting from universal health coverage. So trying to ensure health coverage for each and every human being at the earth, at the planet. And that the third place, actually, I put it at the third place, but as you can see from this graph, they're equally important, is the emergency aspect, which COVID-19 actually is. So to have 1 billion more people better protected from health emergencies. So as you can see, the protection from health emergency is very, very high at the agenda of WHO as well as of the entire United Nations. When it comes to the legal basis towards the WHO, let's call it authorization to respond or to react and to act actually in public health emergencies, the most important, almost the only one standing alone piece of legislation, which is actually one out of only two globally legally binding documents that are ratified by member states of WHO. So it is international health regulations. It has been developed back in 2005, but it came into force in 2007. So actually, it provides a new legal framework, which is important for the purpose of this conference, of today's event, because this is here we have today the representatives mostly coming from the law environment. And as I said, it is legally binding document to contain all kinds of health threats that may rapidly spread from one country to another, from communicable diseases that we have now, that kind of threat, to chemical, radionuclear, and all other accidents. It is called all hazard approach. WHO is a custodian of the international health regulation. Now we are coming to the role of WHO. I missed to say at the beginning of my presentation that I structured the presentation today more, it is more oriented just to present the general role and position of WHO, but the particular questions regarding the WHO in terms of response to COVID-19, I expect to have them during the discussion later on. First of all, I would like to present you the framework, the legal framework within which the WHO operates. So WHO is considered the custodian of the international health regulation. What it means, IHR, International Health Regulation, defines the obligation of countries to rapidly assess, report, and respond to public health events. And towards the WHO, IHR defines the procedures the WHO must follow to uphold global public health security. So we will see later on what it actually means, what kind of interactions between WHO and member states are defined by international health regulations, IHR. So there is an Annex 2 within the IHR that defines which health threats, which public health threats are actually, where is the obligation to notify the WHO what kind of public health threats. And there are 4 criteria. So if somewhere happens something that might affect public health or health in some country, so it should undergo rapid assessment, rapid risk assessment, and it should be made by the local health authorities. So 4 criteria we have here. If 2 out of 4 are fulfilled, then it means that that particular public health threat is prone to be notified, actually is mandatory to be notified to WHO. So first criteria is the public health impact of the event serious or expected impact even. Second criteria is the event unusual or unexpected. Third one is there a significant risk of international spread? And the fourth one is there a significant risk of international travel and trade restrictions? As you can figure out yourself now, so COVID-19, since its beginning, it became very early, it became clear that it fulfills actually all four of these criteria. So it has been treated like that since the beginning. And there are four situations or four public health threats that are mandatory to be notified to WHO without any undergoing assessment to previously mentioned four criteria. So it is SARS. So COVID is actually type of SARS, as we all know. There is a smallpox, which we as WHO consider eradicated at global level. There is a wild type of poliomyelitis, and any new subtype, but new, it is important, new subtype of human influenza. So WHO is declaring when needed public health emergency of international concern, and COVID-19 is declared, officially declared, public health emergency of international concern. How it works actually from the legal perspective view. So, and the IHR defines the existence of IHR emergency committee. It is consisted mostly of experts from different member states, and it's been formed ad hoc usually. So there are no people that are permanent members of this IHR emergency committee. For instance, in case of COVID-19, it was consisted of 16 international experts in the field. 14 of them were coming from independent countries, member states actually, and only 2 of them are coming from WHO. This is WHO policy, this is WHO constitution. We will see later on the WHO actually has no any authorities to impose anything. WHO is actually based and driven by member states, their decisions. It is also reflected here in the composition of IHR emergency committee. So in case of COVID-19, when IHR emergency committee were nominated and members of the committee nominated and summoned the first 22nd, 23rd of January 2020, WHO had mostly the role of more like a secretariat, rather like a secretariat than the expert organization that can impose any decision. So based on the recommendations provided by the IHR Emergency Committee, WHO Director General declares public health emergency or of international concern. These recommendations are temporary and require 3 monthly reviews. So far, since 2007, when the existing IHR came into force, we had declared only 6 times fake public health emergency of international concern. First time it happened back in 2009 when we had swine flu pandemic. Then in 2014, when we had a reemergence of polio in Syria and Uganda. Then it was, the third one was also in 2014, it was outbreak of Ebola in Western Africa. Then in 2015-16, it was Zika virus epidemic. In 2019, we had another outbreak of Ebola. It happened in Democratic Republic of Congo, Kivu area district. And finally, 2020, COVID-19. It is still ongoing. As I already mentioned at the previous slide, the recommendation is to be reassessed every 3 months. So far, it is still international public health emergency or international concern in place regarding COVID. So after the experience with Ebola in 2014, I mentioned that earlier, WHO realized that during the decades, it has been structured and organized much more like a normative agency than the agency that has real capacity and potential to provide itself rapid response. So then then WHO developed the first emergency response framework, trying to define its obligations and tasks, how to respond and how to react to public health emergencies, and what kind of structures needs to be established. And in 2017, WHO Health Emergency Program was founded. So it is a specially dedicated, huge global program under the WHO that aims, sorry, can you give me just a couple of seconds to bring a glass of water? Just a couple of seconds. It's not COVID, thank you. I'm tested and vaccinated. So I underlined the WHO Health Emergency Program called WHE. And in 2017, the second edition of Emergency Response Framework actually precisely defined tasks, obligations, structures, mechanisms of WHO response. Actually, it is more fair to call it WHO support to member states when the public health emergency happens. So WHE actually treats and implements three elements of emergency management cycle. First is prevention and mitigation. Second one is preparedness and readiness of the countries, which actually means encouraging and supporting in every sense, strengthening capacities of member states, of countries, capacities to be ready, prepared and ready to provide rapid and adequate response to any kind of public health threat and emergency. And of course, third element is response and recovery. When it comes to ERF second edition, it defines WHO as Global Health Cluster Lead Agency. So it has definitely lead role when it comes to the health emergencies. And organizations work on health security and humanitarian action is defined here. So it is mostly dedicated to early detection and risk assessment of situation analysis of a public health event or emergency. And the second aspect is grading process, how to grade the existing public health event or health emergency. What are the core functions, critical functions of WHO when it comes to the emergency response under the incident management system? I put only an acronym here, IMS, but it means incident management system. So it is up to WHO to provide leadership, to provide partner coordination. As we said that at the previous slide, it has a leading role in health cluster and should coordinate all the relevant partners in the field, like UNICEF is, other UN organizations like Red Cross and Red Crescent, et cetera, information and planning. So together to compile information and based on them to do some planning, how to respond. Health operations and technical expertise, where needed, if the countries affected by health emergency have no sufficient capacity, WHO should develop its own capacities to organize and conduct health operations and technical expertise in the field. Operation support and logistics. WHO is not investing agency like UNDP is, like UNOPS is and other agencies, but still during the COVID pandemic, it has been able to mobilize a really significant material resources from donors all over the globe and to support the capacities to respond to COVID-19. And of course, finance and administration is always last but not least, as usual. How WHO works in countries. So the WHO work in member states, in host countries, is based on so-called BCA, or which means biennial collaborative agreement. So it is basic agreement. It contains, for instance, the current one, which is about to end now at the end of 2021. It contains several aspects. Vaccine, it treats vaccine preventable diseases. Of course, it's agreed jointly with the Ministry of Health of the hosting country. Antimicrobial resistance, non-communicable diseases, reproductive, maternal, newborn child care, healthcare and health, health and environment, or environment and health, national health policy strategies, integrated, people-centered health services, health systems, but emergency and crisis management, which became, of course, very, very important. Ad hoc work and collaborating center. So as we are all witnesses now, so apart from signed in advance last biennial collaborative agreement by WHO and Ministry of Health of Serbia, of course, COVID-19 has brought a lot of ad hoc work. So we couldn't continue with all our previously defined aims and goals. So what are the challenges? I'm about to finish the presentation. What about the main, what are the main challenges of WHO when implementing its role? So it is intergovernmental organization, member states driven. I underline this. Why? As I said, there is a wrong perception maybe in general public all over the world. The WHO can impose some public health or other measures in COVID or out of COVID, but it's not truth actually. So we will explain that more in this during the discussion. So WHO does not have that kind of mandate to impose anything, just to provide technical support, guidance, recommendations, and things like that. UN bureaucracy, of course, is one of the impediments. Federal structure with 6 elected regional directors. So we undergo also elections like in countries for the regional directors. And there are 3 organizations in one actually. One could be considered normative agency. The other one is technical advice in the field and operational emergency response. Very high reputation leading to very high expectations. That's why WHO is sometimes perceived as a slow organization, because we cannot afford ourselves to act too quickly and to come up with a very quick recommendations if we don't have sufficient quantity of evidence, scientific-based evidence. And just for comparison, of course, it is always limiting factor. Just to compare, the WHO's annual budget is around approximately $2.2 billion US. And just in comparison, American USA CDC annual budget is 11.1 billion USD, 5 times more than that. So it presents a certain limitations. I mentioned these things already. And here I prepared, we can go quickly, but I would not go bullet point by bullet point. Just would like to provide you how quick response of WHO was, despite maybe the opposite perception of some parts of the public. So on December 31, 2019, the Chinese government reported a cluster of atypical pneumonia of unknown cause or etiology to WHO. January 1st, WHO activated emergency management teams. January 4, 2020, WHO announced on electronic media the existence of cluster of pneumonia. On January 10, so only 10 days after the notification of this disease in China, WHO issues the first package of comprehensive guidelines for case detection, diagnosis, and care, and clinical care, of course. After China released the full genome sequence of the virus, and also on 22nd of January, WHO confirmed the interhuman transmission. So since 22nd of January, when WHO confirmed the interhuman transmission, it took only 8 days to January 30 to 2020, when the WHO Director General declared the public health emergency of international concern, as I mentioned before. So what is our aim? Here we have I have presented what are the differences between equality, equity, and reality. We are aiming for equity, like you can see. So it actually means to go to the reality and try to rearrange the existing resources and capacities and to reallocate them. Thank you, and sorry for being a little bit long. Over for now from my side.